New videos every day.
Hi everybody. Today we're going to interview Miss Kaylee. Miss Kaylee's been having some problems with her back, and I wanted to kind of just show you some of the things that we would ask her, the questions that we would ask her, and then later on in the video we may actually do a real adjustment to show you how we would treat something like this. So Kaylee, tell me, what's been bothering you?
It's mostly my lower back and my neck that bothers me.
Okay.
So most of the time, just throughout the day.
Okay.
Sitting down, you know.
All right. And how long has this been bothering you?
It's actually been bothering me for a couple of years.
A couple of years.
Yeah.
Okay. And have you ever done anything to try to make it feel better?
I've done, I used to do yoga and that kind of thing and try and build up strength in my back, and that helped a little bit for a while, but I don't get a chance to do that very much anymore. All
right. So you were doing yoga and it kind of helped a little bit, but since you don't get to do that very much, now you're back to having problems again, right? Yes. And do you have any pain that's coming down in your arms or shoulders or upper back?
No, I mean, my shoulders get tense sometimes, but it's not a day-to-day thing.
Okay. All right. And what about in the legs? Do you have any pain that comes down in the rear end or into the legs at all?
No.
Okay. And you said this has been going on for years. Can you remember a time in your life where you may have had something that happened, like a slip or a fall, or maybe an athletic something that happened?
I did have an athletic injury when I was in high school, and that would have been about 6 years ago.
And so tell me what happened.
I fell and threw my knee out, actually.
Okay.
Threw out my kneecap and just fell.
Ouch.
Landed all over myself, and I was pretty banged up.
Were you doing gymnastics or?
No, I was doing a dance team, actually. High kick.
I gotcha. Yeah. All right. So that probably hurt for a while.
Yes.
And then you also mentioned that recently you'd been in an automobile accident where somebody kind of T-boned you at about 10 miles an hour.
Yes.
And you said it didn't throw you around too much, but there was a lot of damage done to the car.
Yes.
Okay.
There was definitely a lot more damage to the car than to myself.
Okay.
I think.
So just talking with Kaylee for a few minutes, we've already found out that she's got, some injuries due to sports type injuries that are years ago. And this is very usual that we see issues like this where somebody had an injury and maybe it wasn't really handled quite right, or they just thought the pain would get better or go away. And then years on down the road, we start seeing more problems associated with that. A lot of you out there can relate to having injuries and then having them come back later on. In more recent history, she's been involved in an automobile accident. And even though she thinks that, there may not have been very much damage, there's thousands of pounds of force that's being slammed into that car. And a lot of it, not all of it, but a lot of it goes right through the frame of the car and into her little spine, which can cause damage. So anytime you're in a fender bender or an automobile accident, it's always a good idea to get the chiropractor to check the spine to make sure that it's not out of alignment. Oftentimes it can be out of alignment and there not be a lot of pain associated with that. But if it's not corrected, then 5 or even 10 years later, you can start developing problems as a result of that accident. Is there anything else in your history that stands out that may have been a problem? Have you had any children or anything like that?
No children.
Okay.
Not anything that's particularly stand out. I mean, I've had a couple car accidents over the course of the past 5 or 6 years.
Okay. So you've had several car accidents now.
About 3, actually.
Okay.
So.
All right. And this is important because I remember the first time I asked her if she had any accidents, she told me no. So we sometimes don't think about things like that. And as long as she didn't go to the hospital, she doesn't really think about it in terms of being an accident. But the way you determine how much force there is you multiply the weight of the vehicle times the speed of the vehicle. So if you have a 2,000-pound car, traveling at 10 or 20 miles an hour, that is a lot of force that goes directly into the spine. It's enough force to shear a telephone pole completely in two. So that could definitely do some damage to the spine.
Absolutely,
yes?
yeah.
Absolutely. Okay. So what we would do next and what we will do next, we would examine the spine to find out exactly where your problems areas are, and then we'll make some corrections based on that. First thing we're going to do is we're going to check her reflexes. This is real important because it lets us know if there's been any damage done to the spinal nerves that may be of a more permanent nature. And that one is working fine. You just drop your arm there. Feel your arm do that? That's a good thing. Good. Now the reflexes in her upper extremity are good, and what that'll indicate is that there's no permanent damage done to the nerves up in the neck area. The nerves from the neck do funnel down and go all the way into the arms. We're going to check her legs now. Uncross your feet for me. Good. Good. And then we're going to check this one back here. Just relax your foot. Good. Now Kaylee's got really good reflexes, so I might anticipate that her care will probably go pretty easily. We're going to also check one other thing. Do you ever get any numbness in your hands?
Sometimes, every once in a while, but
okay.
It's not very often.
All right.
Yeah.
I want you to hold your hands out like this for me, and I just want to know if it feels the same on this one as it does this one.
Yeah.
Okay.
This one was a little later.
Okay.
Those are the same. About the same. Yeah, and that was it. I only noticed.
Let's try that one again. There.
It's a very, very
slight difference,
but not by much.
We use this little pinwheel to test how well the patient can feel on both hands and if there's any difference there. And the reason that's important is because if Kaylee has a pinched nerve up here in her neck, she'll experience some numbness in her hand. A lot of people come to me and they want me to fix their hand, and they get a little bit confused when I start looking at their neck. The nerves from the neck radiate all the way into the hand, and when they're pinched here, they can cause the numbness in the hand. So she's doing pretty good in that area. I'm going to reach up and kind of feel over the bones in her neck here, and I can actually feel that she's probably got some sensitivity right here on this right side. Is that correct?
Yes.
Yes, it is. And when I feel of a person's neck like this, I can actually feel if the spinal bones are in the correct position or not. And hers have been rotated some on that one side. Now, when that happens, it can cause the spine to start to get a little bit uncomfortable, especially if I touch it there. But those, do you get headaches at all?
Yes, actually, I get migraines.
Yeah.
So.
And it's really interesting, Kaylee, because these nerves that radiate come out of the spine, not only do they go down into your arms, but they radiate back up into your head. Mm-hmm. So if I was to grab a hold of that nerve in your neck and start squeezing it, do you think that might cause a migraine headache? Yes or yes?
Yes.
Absolutely. And so what my job would be to do is to take that pressure off of that nerve, so that would help to alleviate the migraine headaches. Okay?
Okay.
And actually, it feels really good when we do that. Mm-hmm. All right. Can you stand up for me? I want to do a quick check on your lower back.
Okay.
And I'm just going to turn you and lean you back a little bit. Is there any lower back discomfort there?
No, but my back just popped.
That's all right. Probably felt good. Turn around the other way. Face that wall. Good. We'll check this side here. Is there any discomfort there?
Yeah, a little bit.
A little bit on that side. Mm-hmm. Okay. Now, usually when a person has discomfort and they're just leaning back and rotating, it means there may be some damage done to the structures of the lower back, bones, muscles, ligaments, whatever. And so that's a good indicator that you've got some lower back issues going on as well. Okay. Now, do you have any other problems like asthma, emphysema, heartburn?
No, as far as that kind of thing goes, I get migraine headaches, and that's about it.
Okay. Any constipation, diarrhea, any bloating, any trouble with your cycle at the end of the month?
No.
Okay,
not
good.
Good.
All right. And so I think what we're going to do, with your permission, I'm going to go ahead and show them how we would go about helping you with these problems. Okay?
Absolutely.
So let's have you lay face down on the table. All right, so we've already determined through our examination that Kaylee has got some damage to the structures in the lower back. Now, what I mean by that is the vertebra may be damaged somewhat due to being out of place. Just like a car tire would get damaged if you drove it with it crooked, it would start to become damaged. There's a little spacer or disc in between the lower back that can also become damaged here. So we're going to put a little bit of mild traction on this lower back and just kind of stay in touch with Kaylee here and see how she does with that. This can oftentimes bring great relief to people with lower back pain. Kaylee, I'm going to get right on the skin here. And we're just going to gently kind of flex this and let me know how that feels in there.
Definitely feel like it's getting stretched, and it's a good thing.
It's a good thing. All right, very good. This is a great technique for people who want to prevent having lower back surgery. It's also a great technique for people who have already had lower back surgery and they want to prevent another one. Now, Kaylee, if you get a little bit sore after this technique, I don't want you to worry. It's just like going to the gym, or you mentioned some yoga classes where you might have gotten a little bit sore. Okay? It won't be anything drastic, but don't worry. Now what I'm going to do is just kind of stretch your back out right here a little bit. You may hear a little clicking noise if the vertebra moves in there. That's perfectly okay. Breathe out. And I can feel in there that part of your spine is pretty rigid, pretty tight. Breathe out again. Breathe out, a little push here. There we go. How'd that feel?
That felt awesome.
Yes, I thought you'd like that. So what we determined by feeling of Kaylee's back here is that she had several vertebrae that were kind of locked together and weren't gliding and moving freely one on the other. And when that happens, there can be a little bit of swelling, a little bit of tenderness, and it can go on to lead to arthritic changes or degenerative changes in the spine. So once we located that area, we just made a real little mild adjustment that gets those vertebrae moving. And Kaylee, what did you say that felt?
That felt awesome.
Yeah, it actually feels really, really pleasant when that happens because it's taking so much strain and stress off the person's spine. Okay, so we're going to wrap this up for today. Kaylee, how was your adjustment today?
That little adjustment, I can already tell just like by laying on the table, it relieved a lot of pressure.
Good.
Instantaneously, so it was great.
Excellent. And we got a little bit more work to do on you, but I'm sure you're going to be a lot better. If you need more further information, please visit my website at www.jeffechols.com, and I will see you later.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.